everybody. I'm Dr. Joseph from United Bariatric Center of Kansas City. Today we have a distinguished guest and expert in medical weight loss, Dr. Jason Bergman. Some of you may have already seen him previously. He's also a family physician, and he's a board certified bariatrician and a family physician. He has been with a part of our program for many years, and I've been lucky to kind of work with him for the last many years as part of our program. And today we are going to discuss some of the options that are available in the market right now in terms of medical weight loss, all the options that are available, the benefits, risks. So welcome,
Thank
Dr.
you.
Bergman.
Appreciate it.
So, one of the common questions that you would, or the patients may have is, what are the components of medical weight loss that they should expect?
Sure. So whenever I see anybody for a discussion about weight loss, first of all, I want to figure out, what brings you here? What are you looking forward to? What are your goals? And then I want to help them get there.
Yeah.
And, if we're looking at just medication by itself, if we're looking at just surgery by itself, if we're looking at just diet by itself or exercise by itself, it's not going to work. So it's a combination of all of those things. I tell folks it's about nutrition, it's about activity, it's about lifestyle modification, and it's also about medication or surgery if medically appropriate.
Right. So it's the overall process. There is just not one thing. Patients have to make behavioral changes, exercise, diet, medications, and everything put together.
Absolutely. Takes a team.
It takes a team, yeah. And in general, how long does the process take? I mean, for how long do you have somebody do medical weight loss? Or is there a time period? Or
we'd like to think that if I could just get to my trip in June, if I could just get to that wedding in September, and see the doctor for that period of time and get myself fixed, first of all, you're not broken.
Yeah.
And second of all, weight, it's a long-term health issue.
Yeah.
I mean, it's been identified as a long-term medical problem in itself, a medical disease.
Correct. Yeah.
And when we look at it as a short-term thing, we don't win the marathon, we lose that short race.
That's right, yeah.
And so when I see patients for that, I give them that understanding that, hey, I'm going to get to spend some time with you. And so when we're evaluating for people for the program in surgery, we'll see them sometimes for 3 months or 6 months, sometimes 6 months if depending on what the insurance decides, but certainly for our program, at least 3 months.
3 months.
And you're like, man, that's 90 days. That keeps me between my surgery, my freedom, my ability to do all the things I want to do. But it's a process.
Yeah. And if the patients do not want to pursue surgery, you could still continue seeing them even after that.
Yeah, I think that's a great opportunity about our program is that we have that flexibility. There are people that I see for medical weight loss, and they just haven't been able to make that progress that either of us would like to see.
That's right, yeah.
And I'll say, I got these guys. I got Dr. Akhtar, I've got Dr. Joseph. Maybe we should put you in touch.
Yeah.
Likewise, you send me folks.
Yeah.
And we'll talk, and they'll say, I think I'm really making some progress. I didn't understand the whole lifestyle change. I was counting on medication, or I was counting on just not eating for periods of time.
Right.
But when they get it all put together, then they say, I think this is something I can run with.
Okay. And in general, if you put it in percentage wise, how much percentage of excess weight loss is one that one can expect with the medical weight loss on an average?
On average, so I wish that our numbers were better, truly, and they are getting better. We've got newer medications out, but on average, about 5 to 10% weight loss is what we can expect with most medications. Mm-hmm. Now, some of the newer ones, they're more promising. We're seeing 15% and even upwards of 20%.
Uh-huh.
So when we look at fractions, and if math isn't there for you, basically take the first 2 numbers of your weight, and that would be the 10% that we could expect to see lost.
Okay. Okay. Now that you mentioned medication, so what are the newer medications, or what are the common medications that you will be using?
So the medications for weight loss has a long history.
Yeah.
And probably ones that we're common with are phentermine, there's phendimetrazine, there's been Contrave has been one of the relatively newer medications indicated for weight loss. There's been Qsymia, which combines phentermine with topiramate. There are injectable medications, Saxenda is one of them, Wegovy
Yeah.
is the newest one.
Yeah.
So those belong to a category of GLP-1 agonists.
Yeah.
So there's a complex variety of medications that are available,
Yeah.
and you know, it's really hard to know which one is right for a
Yeah.
patient.
Yeah.
But it isn't really until I sit down and spend some time with them and talk about what those triggers are, right?
Yeah.
I'm hungry all the time, or
Yeah.
I just can't feel satisfied with food, or I eat because I'm bored, or I eat because I'm sad.
Mm-hmm.
And it just depends on what that person's dealing with, which medications would be best for
So
them.
it's kind of tailor-made for individual needs and patients' individual problem.
You know, I'll be honest
Pretty
with you, it's overwhelming as far as the options that are out there.
Yeah.
And certainly even we use medications that are off-label for
Yeah.
weight. But trying to find that right medication for a person, it's not just taking a dart and throwing it at the wall and seeing what sticks.
Mm.
It's listening to the patient.
Yeah. So I understand that some of the medications are covered by insurance and some of them aren't covered by insurance. Is that right?
Well, as you know,
Yeah.
there are things that the patient wants to do.
Yeah.
There are things that the doctor wants to do for the patient.
Yeah.
And then there are things that the insurance company will
Wants to
allow the doctor to do for the patient.
That's right. Yeah.
And
Well put. Yeah.
thank you. So we're coming around, and it's taken a long time, but finally recognizing that there's more benefit in trying to prevent those illnesses of diabetes, of heart disease, of stroke, of loss of limbs, of joint replacements, and to address the root cause, which is weight itself.
Yeah.
That being said, there still is a significant deficit in folks that are insurance companies that are covering medications.
Okay.
So we do end up going with, you know, hey, maybe this person's better tailored for one of those medications like Saxenda or Wegovy.
Yeah.
They just don't feel satisfied with a meal. But because insurance doesn't cover it, we have to go for a generic medication.
Okay.
Or we have to start looking and being creative, like what kind of savings programs do pharmacies have with drug companies?
Okay. So that I think leads to the next question. So from that I understand the expense that one patient could incur can vary from a couple of $100 to a couple of $1,000.
Yeah, so there are medications out there that are $3,000 a month.
Yeah.
If you don't have any coverage for that medication.
Okay.
You know, weight is an impacting thing to people's health, and it is amazing the lengths that they will go to seek the help that they need.
Yeah.
And so there are generic options that are as affordable as $30 a month, all the way up to several $100s a week for shots, and then all the way up to, like I said, $3,000 for 90 days at a time.
Okay. So a couple of drugs that is obviously taken the market by storm is Wegovy and Ozempic. You're prescribing both of them?
So from a medical purist perspective, there are medications that are indicated specifically for weight loss.
Yeah.
Wegovy is the one that's in that category. Ozempic and Wegovy are both semaglutide.
Yeah.
It's just that the Ozempic stops at a set dose, and then the Wegovy continues on. So the initial indication for Ozempic was for diabetes. And they noticed that not only were patients having better blood sugars, but having weight loss.
Yeah.
And so then looking at if we increase that medication, if we push the envelope a little further, do we see more weight loss? And in fact, they did. So now we have a new indication for the medication. They can relabel it.
Oh, okay.
And so now it's Wegovy.
So the weight loss is dose adjusted, is dose related. Higher the dose gets more weight loss?
Well, yes and no.
Okay.
Yes and no. Now that's an interesting point as well, because I've had people that I start on a very low dose of the medication,
Yeah.
and they go, "Oh my gosh, I've never felt satisfaction with a meal."
Yeah.
And that's their dose. That's all they need.
Mm-hmm.
And then I've had people that I put on the highest dose of that medication,
Yeah.
and they gain weight.
Uh-huh.
So it's not a one size fits all.
Oh, okay. Okay.
But it is a dose dependent curve that we're seeing, that up to like 20, I think it's like 18% is the maximum benefit
That is
from
given.
Wegovy.
Okay. So it's a once a week shot?
Yes.
Once a week?
Yeah.
And for how many months do you give that shot?
Well, so I'll start folks out at the lowest dose,
Yeah.
and then I'll see them back within a month.
Yeah.
You know, that's part of what our program is all about, is
Yeah.
this continuous follow-up, this reassessment. How are you doing on the medication? What are you doing in your life that's working for you? What isn't working for you? How are you doing on the medication?
Mm-hmm.
And then it's really based on what we're seeing objectively in the numbers,
Yeah.
but also subjectively, how's the patient responding to the medication.
Okay.
So I'll give them a first month
Yeah.
prescription,
Uh-huh.
and then if they need to go up in the dose, then we'll go ahead and do that.
Oh, okay. And how long do you tend to continue generally?
So these medications are indicated for long-term weight management,
Yeah.
and this is more than just the regular. Even what I used to do before I was board certified was I prescribe medications like fentanyl being the common one. You prescribe it for 90 days,
Yeah.
and you say, let's see what happens if we stop it afterwards. We know what happens now. The weight comes right back on.
Exactly. Yeah.
So these medications like Wegovy, Saxenda, they are a long-term medication for you.
Okay. Okay. Again, that leads to the next question, that there is a mass shortage of these drugs all over the country.
Mhm.
How do you circumvent that in your day-to-day practice?
So there are indications for medications. They talked about the ones specifically indicated for obesity, but also the ones for diabetes.
Yeah.
And certainly we know folks that have weight issues have the metabolic triad, if you will, diabetes, high blood pressure, high cholesterol. So we can go that angle with the diabetes route and prescribe medication like Ozempic for them.
Okay.
Or the lower dose of Saxenda is Victoza. So we can prescribe Victoza.
Oh, okay.
It's essentially the same medication, just at a lower dose.
Okay. Okay.
So we look for what's medically indicated,
Yeah.
and then what's available,
Yeah.
and then what's insurance willing to pay for.
Okay.
There are other options out there. Certainly you've probably seen them in your practice with folks getting semaglutide
Yeah.
as a compounded medication.
Uh-huh.
We're not exactly sure how that medication is coming to be.
Yeah.
The drug company that has that medication, they hold a patent on it at least until 2026.
Yeah.
But I think part of how they're getting around that is that the shortage, if a compounding pharmacy can fill that void of the shortage, then they're allowed to provide it.
Okay. So for Ozempic, for you to write Ozempic, does the patient have to be a diabetic to be covered by the insurance?
Yes.
It has to be.
Yes.
Otherwise, it's a self-pay. They have to pay from their pocket.
Yes.
All of them. And what about Wegovy?
Wegovy, typically you just have to document that they have tried and failed a structured diet and exercise program for 6 months duration or more, that they have a BMI that is greater than 27 with a comorbidity, so something that's associated with weight. And those three things that we talked about, there's mechanical issues of weight, there's reflux and sleep apnea and joint health issues. All of those are in that category for the BMI of 27 or less.
Okay. Okay.
Now we have folks who fortunately have not had to deal with any of those metabolic or mechanical issues of weight thus far,
Yeah.
but they have a BMI more than 30.
Yeah.
They still qualify for medical weight management, and we can write that as a diagnosis.
Okay. So if you meet those criteria, most of the time, the insurance companies covers the medications for the most part, or just infrequent?
It depends on the insurance plan, the employer carve-outs. recognizing again that employers are getting on board.
Yeah.
And some employers are saying, hey, we'll cover this medication, and others just haven't quite made that leap.
Yeah. Yeah. And what is the success rate in general with all this?
I'd have to go back to history and where I started before
Yeah.
I know what I know.
Yeah.
And I know that I had a lot of classes in med school
Yeah.
and not enough focus on weight as a health issue in itself.
Yeah.
And so I gave the same mantra that everybody else has heard who struggles with weight, which is diet and exercise. You just got to eat less and move a little more.
Mm-hmm.
And we know through hormone signaling and studies that this is a very complex illness.
Mm-hmm.
So to say that just medications are the one thing we can focus on, it has to be the full picture.
Yeah, yeah. Oh, no, I completely agree. It's what are the side effects that one can expect?
So there are different categories of medications. I named some of them off, but didn't really give you like where they fall. But stimulant type medications.
Yeah.
So everything you think that a stimulant type medication
Uh-huh.
could have is a possibility. So fast heart rate,
Mm-hmm.
very dry mouth is a common side effect.
So you're talking about phentermine?
Phentermine,
Like medication, okay.
Yep.
What about the other ones, Saxenda, Wegovy, and
Saxenda, Wegovy, sure.
Ozempic? What are the common side effects? Do they encounter any side effects often, or most of the time it's pretty well tolerated?
Well, some things that I've seen, shot site reaction.
Yeah.
Obviously, anytime we're putting a medication to the skin that's not been there before, you can have a reaction.
Uh-huh.
So we've seen that. Nausea is probably the biggest side effect of the medication. There's been certainly that early fullness that people haven't been able to experience previously.
Okay.
There's other GI issues that can happen, either constipation or diarrhea, that can unfortunately be a side effect. In my experience, that tends to be more nutritionally dependent.
Oh, okay.
So
Okay.
it's not uncommon that we have other medications that we use.
Okay.
Cholesterol medicines, for
Right.
example.
Right.
A particular example I can think about, I see folks that I know and they're on cholesterol medications and they're enjoying a nice big steak and they
Yeah.
say, no, don't worry, doc, you got me on the
Yeah.
cholesterol medication.
Yeah.
It's not a shield,
Yeah.
it's a tool.
That's right. That's right.
And so if that goes back to that lifestyle modification part, if we're not able to make those changes in our life and we're just counting on the medications,
Yeah.
those side effects are going to maybe guide our principles a little more as to what foods work for us and what don't.
Mm-hmm. Yeah. So when you prescribe all these medications, you also kind of give them good counseling on the diet that they are expected to have on a day-to-day basis, the exercise.
Yeah. Yeah.
Along with. Now, let's say in some patients, the plan doesn't work. What do you do for those patients? Like, do you do any particular tests, like thyroid or either medications or anything that is that you perceive as, this is the reason why these patients are not losing weight?
Sure. So there's a baseline set of metabolic panels, thyroid. We all like the thyroid to be out of whack to fix that.
Yeah.
But it may be more complex. Sometimes it's the medications that people take.
Yeah.
Medicines that we otherwise think are meant to, even medications we use to help with diabetes
Yeah.
can cause weight.
Mm-hmm.
Medications that are used to help with sleep cause weight problems.
Yeah.
Blood pressure medications make it harder for you to lose weight.
Yeah.
So it's taking a keen eye really on
Psychiatric medications.
Absolutely,
Yeah.
absolutely, psychiatric medications.
Yeah.
So it takes a keen eye to really go through there and see what's essential.
Yeah.
And why did we pick that one? Why did we pick that one versus another one?
Yeah.
Maybe it's just that's the language we speak. We just didn't know another medication of that day.
Yeah.
And I've always been on that medication since then.
Yeah.
So looking at medications, certainly the metabolic panel stuff that we talked about, laboratory, sometimes we can dig a little deeper and it's really hard to see the forest for the trees. But the mantra I think about is if we do what we've done, we'll get what we've got.
Yeah, that is right.
And so I'll hear often, I'm not doing anything differently.
Yeah.
But could we?
Yeah.
Could we do something different?
Yeah.
And you talk about diets and which diet do I tell people to go on and take. There's lots of diets that you'll hear about. There's low fat, low sugar, low salt, low calorie, eat everything you like, but smaller portions of it. There's don't eat anything at all.
Yeah.
And all of those diets, which I hate the word diet. Diet's a 4-letter word. It truly is.
That's right, yeah.
And when we say the word diet, it implies there's a beginning and an end.
Yeah.
And truly this is a nutritional change. So when we look at nutritional change, things that are going to take the least amount of effort for one to do is the thing they're most likely to stick with.
And what is your take on all this keto diet and all those short-term packaged food dietary measures that many a times these patients seek for 3 to 6 months?
They work.
They work, yeah.
And sometimes for folks who've been so defeated and haven't been able to see any kind of change, they just need to see something.
Yeah.
And the reason why structured weight programs that we have available, commercial weight programs, etc., the reason why they work is because it's not that person's plan.
Yeah.
Because the plan they've been doing up to this point hasn't worked for them.
Right.
And that's why they have the metabolically sick fat syndrome and can't get past that bump. But then when you give them $1,500 of food in a box, now that's all you get to eat.
Yeah.
You can't go out to restaurants. You can't have DoorDash.
Yeah, but you run the risk of gaining the weight back if you don't change your lifestyle.
And that's exactly it. So what do we take from those nutrition plans? Hey, I like that. I like those box meals that I'm getting.
Yeah.
This recipe looks really good. And I think there's a lot of folks that the box meal things do work for, because I hear a lot of people that work night shift, and then they get off, and then they will try and sleep a few hours, and then they'll get up and take their kids to baseball and dance, and their lives are busy, and they're putting everybody else before them, and then they go through the drive-through, and that's just what they have to do. But you mentioned the to your door meals. Yeah. Maybe not every night. Yeah. You get burned out on them.
Absolutely, that's right.
But if you've got a plan B, if you know there's something that if you're having a bad night, you need to break the glass, there's your meal.
There's your meal, correct, ready made. But I think in the end, it's everyone, even if they are seeking surgery, you agree that it's worth trying all of the means of weight loss, medical weight loss, and all of the paths. And surgery is often the last resort that you should choose. And that's the path that we have taken for the most part. I mean, everyone who's coming for surgery, we've been sending to you for the medical weight loss. And that's the right thing. And that's the right thing to do. I think these patients need to have those behavioral changes in place, even if they seek surgery down the road.
I tell this to everybody I see. Today. Yeah. Today is when we start. Yeah. You don't want to wake up post-op day 0, bandages on your tummy. Correct. Groggy after the anesthesia. Correct. Saying like, okay, now what am I going to do? Right. Start now. Right. Start those small portions. Eat your lean protein. Eat your non-starchy vegetable. Pause. 30 minutes. Then your liquid. Yeah. Because that is a habit that you will have to set for the rest of your life. Yeah. Practice it now. Absolutely. And it starts today. Don't wait until tomorrow. Absolutely. That is right. Dr. Bergman, thank you so much. Thank you. So that's all from us this evening. I'm Dr. Joseph, Dr. Bergman. We are from United Bariatric Center of Kansas City. And thanks for watching.